Good afternoon, and thank you for joining us for Memorial Healthcare System's Facebook Live segment. Today we're talking about something that's very familiar to all of us, and that's headaches and migraines. My name is Lourdes, and I'm reporting to you live from Memorial Healthcare System. Joining me today is Dr. Maike Blaya, our headache specialist from the Memorial Neuroscience Institute. Dr. Blaya is here to answer questions about headaches and migraines.
Thank you for having me.
Thank you for coming. With us behind the scenes is the corporate communications team. We have Gio and Carla and our intern Vanessa, who are monitoring the Facebook page for your questions. So kindly engage with us, post your questions on the comments page, and we will gladly try to answer all of them during our live broadcast. So if we lose a signal, we're going to ask you to kindly just stay tuned. We'll be back momentarily. So, doctor, let's try something really, really simple. What are headaches?
So headaches is a very subjective symptom, is a complaint that cannot be really measured by diagnostic tests or laboratory tests. So it's hard sometimes for the patient to explain themselves what type of headache they have, what they are feeling, and not every doctor have the time and the patience to see them and take care of them.
Are there different types of headaches?
There are multiple types of headaches. The majority of the headaches are actually secondary headaches, headaches that are caused to, that are related to another cause. For example, the majority of many of the headaches might be related to fasting. Fasting is the most common cause of a secondary headache, which is like if you don't eat for a long period of time, you might have a headache. There's also headaches from being too tired or not sleeping well, or sinus headaches are also very common secondary headaches, or side effects from medications, or headaches related to an infection or a sickness. So those are the secondary headaches. The patients that I more often see in my clinic, in my practice, are the patients that have headaches without a particular cause.
Are those known as primary headaches?
Yes, so those are the primary headaches, and those can also be subclassified as the tension type headaches, so those are the most common ones. The migraine headaches, and that's my favorite topic, and then the most uncommon headaches in that category, the cluster headaches or the trigeminal neuralgias, the autonomic neuralgias.
Well, I'm glad you said that migraines are your favorite, because we do have a specific question about that. I think most people wonder, what is a migraine?
Yeah, so there was this whole, month of June was the awareness month, because the American Headache Society and all the neurologists that work with headache, we really want to bring awareness, because migraine is a chronic neurological condition like any other neurological disease. And so the definition of migraine, there is likely an increased sensitivity of the brain in patients that suffer with migraine. So they can feel things, external stimuli, they can feel it more than they should. For example, sounds might feel louder for a patient with migraine, or lights might feel lighter, more bright, and smells might feel stronger. So they kind of have this hypersensitivity.
Okay. What should someone do to seek treatment for a migraine?
Every patient, every person that thinks that they have migraine should probably see a headache specialist. We know based on studies that patients with migraines that seen a headache specialist were more satisfied with their care than seeing even a general neurologist, because we know that migraines are underdiagnosed and also undertreated.
So thank you, Dr. Blaya. If you're just joining us, we're here with Dr. Maike Blaya, our headache specialist for the Memorial Neuroscience Institute, and she's answering questions about headaches and migraines. So please engage with us and send your questions to our comments section, and we will try to answer all of them during our live broadcast. If you would like an appointment with Dr. Blaya's office or any one of the neurologists in the Memorial Neuroscience Institute, please call 954-265-9500. So let's talk a little more about headaches. How do you know if your headache is actually a migraine? How do you tell them apart?
So any person that have headaches that are on and off, that come and go, and have other symptoms like migraine, is not just a headache. Migraine there is a variety of other symptoms associated with migraine. So any patient that have on and off headaches, or any patient that has the headaches associated with nausea, or associated with, like we said before, we talked about that before, light sensitivity, sound sensitivity, or that smells bother them during the headache, they likely have migraines.
You said that migraine symptoms are very different per patient. Are there different types of migraines?
Yeah, the migraine symptoms may vary by different patients, and I think the best way to classify is migraines with aura and migraines without aura. The majority of the patients don't have aura, but it's a very interesting manifestation, migraines with aura.
That's interesting. I've never heard of that. What is aura?
So aura is any manifestation and any neurological manifestation that might happen actually before the headache starts. So it can happen as long as within half an hour before the headache comes. The most common aura are the visual auras. Over 90% of the patients that have migraine with aura, they actually have visual phenomena, visual manifestations. And they can vary. They can look like little stars. Those are the most common ones, like the shiny, the bright scotomas we call. They can be like zigzag lines, or they can be like the person feels that they can only see half of the person's face. And it feels like it's blurred. All the manifestations that you basically can see on the Alice in Wonderland movie, all those kind of like, some patients report that the faces look larger and they keep going bigger and bigger and bigger before their migraines. I have a patient that said that she had like a matrix vision. When she does that in front of her visual field, she sees like multiple hands floating, and then it comes the migraine. So it's very interesting. The other types of aura are the sensory auras. So the patient might have numbness and tingling in one side of the body for a few minutes, and then the headache starts. And the third one is speech difficulties. They might actually have word finding difficulties before the migraine episode. And that can be very scary.
Yeah, it's very scary. These are very concerning to anybody who's really wondering what they're going through. That's very interesting. So let's recap a little bit. How do you know if a headache is serious, considering the auras that you just described, and if you should seek medical attention?
Yeah, I tell patients, if you never had an aura before and you are not sure, those symptoms could be a stroke. So if you have, for the first time, any neurological manifestation, you should go to the emergency room. So going back to the headaches that could be something more serious, there are like the red flags for the headaches. So if it's a headache different from the one you're usually used to, or is a severe headache or a new onset headaches. We always say new onset headaches in the young and in the elderly are always concerning, or a headache associated with other neurological symptoms. So headache with weakness, headache with visual problems, those you should seek attention immediately.
Thank you, doctor. I appreciate it. If you're just joining us, thank you. We're here with Dr. Maike Blaya, headache specialist for the Memorial Neuroscience Institute. She's here talking to us and taking questions about headaches and migraines. And it looks like we actually have a question right now, and our corporate communications team, take it away.
What about auras and with seeing colors and peripheral vision for a few seconds?
Yeah, those are very classic visual auras. And patients actually with migraine with aura, they might have some migraine events, some migraine attacks with the aura and some migraine attacks without the aura. But those are very classic ones. And if they might be from a few seconds to a few minutes. The concerning auras are the prolonged auras. So if you have an aura that goes on and on for over 30 minutes, up to an hour, it's already a prolonged aura. But if it goes beyond that, you probably should be seen in the emergency room and make sure that the aura manifestation does not turn into actually a stroke.
Thank you, Susan, for asking that question.
That was great, Susan. Thanks. And please, as you continue to watch, please engage with us and consider giving us your questions. We will try to answer all of them during our live broadcast. If you would like to make an appointment with Dr. Blaya's office or any one of the neurologists in the Memorial Neuroscience Institute, please call 954-265-9500. For more information about the Memorial Neuroscience Institute and its various services, please visit memorialneuroscience.com. So let's continue, doctor. Let's talk about headaches and parenting for a little bit. Are there best practices for pregnant women who suffer from headaches during or after their pregnancy?
So headaches in the pregnancy can be secondary headaches. So like the secondary headaches we talked a little bit about, but in pregnancy could be signs of hypertension, could be signs that something is going on. Even hyperglycemia can be associated with headaches, so they should first seek attention to their own doctor, to their OBGYN. Patients that have already migraines and they know that they have migraines during the pregnancy, actually in the first trimester, they might experience a worsening of their migraine episodes, and in general, patients get better during the pregnancy. As the hormones kind of like stabilize, they actually feel better.
Oh, interesting. So let's switch to moms and dads, because as parents, things get pretty crazy. We have schedules, we have babies, we have siblings, we have family that we take care of, and it gets pretty hectic. So for moms and dads, are there signs that you may be having a persistent headache?
So maybe you're asking me about the chronic headaches. So so the headaches are usually on and off. Over time, they tend to become more and more often, and they can become chronic. So chronic headache is any person or any headache that is more than half of the time. So that means if you have headaches for over 50% of the time, in 3 months, we can actually define that as a chronic headache. The same with migraine. If you start having more and more migraine episodes, and sometimes it's just because the migraine might be prolonged. So each migraine episode lasts 2-3 days, but you're having migraines twice a week. You are having more headache days than headache-free days. So you have chronic migraine.
So what are some common approaches available now for headaches?
There's a lot of treatment for migraine patients, and they are in general used for the migraine attacks or the medications that we can use on a daily basis to try to prevent the headaches. And actually the treatment for chronic migraines, the only FDA-approved treatment for chronic migraines is Botox injections. And I think we posted early on a picture of a diagram that shows the injection sites for the patients that are candidate, the injections, the Botox injection site for patients that have chronic migraines.
What are options for treating migraines?
So there are the medications options. There are the alternative like vitamins more and more. There are the alternative treatments, and now the new devices. We have 2 new devices that we can use for patients with migraine.
Okay, you want to elaborate on those a little bit?
Well, I have one here that maybe I can show.
Absolutely.
So they were just FDA approved, and I have one that I can demonstrate. So there is the Cephali. I think there is a picture early on the website showing it's a device that you can use like in the forehead. And that device you use at the onset of the headache is to try to prevent the migraine attack for continuing. So you just use that headband in the forehead, and it stays there with like little magnetic kind of like waves, and it stays there for 20 minutes, and after that you remove the device. This one is actually one single pulse. It's a magnetic pulsation, and you kind of like you open up and you turn it on, and I'm not going to do that, but I'm just going to demonstrate. And you have it in the back of the head like that, and you do like a one shot. So that's also, this device is actually approved for migraine with aura. And since we were talking, the visual auras are the most common ones, and they start within the occipital area. So the patient would use that during the aura. They do this little, one pulsation, this little electric shock, and the the philosophy of the treatment is to try to block it. They do that during the hour, and then they don't have the headache, the migraine after that.
Very interesting.
Yeah.
So it seems that we have a question. Go ahead.
Tatiana from Facebook is asking if there is a cure for migraines. Do they go away over time, and are they hereditary?
Unfortunately, there is no cure for migraines. It's a chronic disorder, but you can really learn how to deal with the headaches better. You can learn how to control the headaches better. A lot of patients, a lot of women over time feel that the headaches, the migraines are not as strong. And after menopause, many women no longer suffer with migraines.
Very good. Thank you, Tatiana. We have yet another question.
And actually, I did not
sorry.
answer Tatiana about the genetics, right?
Go
I think
right
I forgot. Yeah, so we know that migraines are probably genetic. It's probably a complex genetic disorder because we don't see a clear pattern. So it's not like from mother to child directly, but it's certainly genetic. And we see that patients that have a genetic, like a family history, they have more chances to develop migraine.
Okay, very nice. Thank you, Tatiana. And thank you, Dr. Blaya. We have yet another question.
Susan from Facebook is asking, well, she's saying that she has combo headaches and they are chronic tension headaches that escalate to a migraine. She wants to know how she can prevent these.
Yeah, those are my patients on a daily basis. The many patients have like different types of headaches, and at some point the patient is actually having trouble to identify what is migraine and what is tension type headache, and that's a very classic symptom or a very classic concern from a patient that has chronic headaches or chronic migraines. Over time, when the migraines are on and off, or they are more rare, you have a lot of the other features associated with the headache. You have the nausea, you have a lot of the auras, or you have the light sensitivity. As the migraines become more often, you kind of lose those, the classic typical features of migraine. So they look like a tension headache, but they actually could be a chronic migraine. You still would treat, so those patients, I probably would still treat with the headache that is more common. So the headache subtype that is more often, that like bothers the patient more, I would treat as that. So that's why it's very important to have a correct diagnosis of what type of headache you have.
Thank you, Dr. Blaya. And if you're just joining us, thank you. We're here with Dr. Maike Blaya, our headache specialist from the Memorial Neuroscience Institute, and she's here answering questions about headaches and migraines. So please feel free, engage with us, post your questions on our comments section, and we'll try to get to all of them during our live broadcast. And we have a question.
Paula from Facebook is asking if there are any new migraine treatments that have come out recently that you think are promising.
Paula, how are you? Yes, there are a lot of emerging treatments, but they are not yet available for us. There is treatments. Finally, we might have a group of medications that are going to be specific for migraine patients. They are currently in stage 2. They are now under trial and under investigation. But I'm sure in a year or two, hopefully, we are going to have these very nice and very exciting treatments available.
Okay, thank you, Dr. Blaya. So for our next question, you just spoke about devices. Very interesting. Let's talk about maybe some other alternative treatments, such as you had mentioned somewhere on your Facebook page, there are some vitamins, relaxation. Talk a little bit about that.
A lot of patients that I see, they come to me and they say, I don't want to take medications. I don't want to use any pills. So there are for the right patient, there are vitamins available for the right patient. There's also the alternative treatments that we call CBT. That is the cognitive behavior therapy. That I usually work with a neuropsychologist to kind of like guide the patients to do that. Relaxation exercise were actually shown in studies to be as effective as medications in the right patient. If they can, achieve that relaxation state during the headache or during the migraine, is as effective as taking medications.
Okay, very interesting. Okay, so we're going to move on to acupuncture and massaging. Does that help as an alternative treatment?
I don't know. I don't know if that helps. A lot of patients try that, and the American Headache Society have looked into it. I think these are those techniques are very hard to study as well. How do you do a placebo group? You do acupuncture. How do you do on the group that is the blind group without telling them that it's not acupuncture? But they have to. So I think they are very hard to study too. The patients get desperate and they try everything that they can. They try, stones over. They try whatever they can, and sometimes you don't have the right answers. But unfortunately, I don't think acupuncture has been shown effective in more controlled studies.
Can integrative medicine play a role?
I do work with integrative medicine a lot because it's not only about getting a pill and going home. You have to kind of like integrate. It's a life-changing style, especially in the patients with chronic headaches, chronic migraines. You have to learn how to like eat right and have a healthy lifestyle and exercise, lose weight. All these things were shown to help migraines. So yeah, definitely.
Oh, that's very interesting. Okay, so let's talk some possible family, environmental, and lifestyle influences. Can your diet make you prone to a headache? You were just talking about diet.
Yeah, so the migraine patients, some of them have very classic things that might bring it on, the triggers some patients have. Not every patient have that. And the triggers sometimes might be even a blessing, I tell the patients, because as they start to understand their headaches, that's why I tell patients it's very important to do a headache diary, because with a headache diary, they can kind of like start seeing a pattern. When do I have a headache and why? So yes, there are very common triggers. In the last meeting in San Diego with the American Academy of Neurology and the American Headache Society, the most common trigger is actually stress. Now, how we avoid stress in life?
I really don't know.
Yeah.
I think that's the big lottery question right there. All right. So does weather affect migraines in any way?
Yeah, the weather changes can be a trigger as well. And this is a very interesting question for me because a lot of patients tell me that they kind of they can feel the weather changing and they kind of like feel that they can tell that something like it's going to rain even before the forecast. So they kind of feel like a warning. And they have that sensitivity to the weather. The warning signs of the headache, those are different from aura. The warnings can happen up to even a day or two before the migraine happens. So some patients start feeling very fatigued or they start like yawning like a lot a day before they're going to have a migraine, or they get very irritated. They know, or I feel like I have like this warning, this sensation that the migraine is going to come tomorrow, and it does, and that's usually related. So again, it comes down to you have to observe the other things and do a headache diary. That's when you're going to identify a pattern and learn how to control those symptoms.
So it's almost like a premonition.
A premonition of the weather.
Right.
Yes.
So writing is good. Keep a diary. That's a
Yes.
good takeaway.
Yes.
Thank you. So we have a question. Take it away.
Myra from Facebook is asking if Botox can help with chronic migraines without aura.
Any chronic migraines, as a matter of fact, Botox is the only medication that is approved by the FDA for the treatment of chronic migraines. So definitely, the auras get less often, actually, as the migraines get more chronic.
Okay. Thank you, Myra. And
Thank
we
you.
have yet another question.
Samantha is asking if it is normal to have recurring headaches after blunt trauma to the head.
That's a very good question, Samantha. And that's another group of patients that I see a lot is the patients that had concussions. Post-concussion headaches are very, very similar to migraine headaches. And specialists believe that the time that the brain is healing is hypersensitive to everything. The brain gets more hypersensitive, and that's what migraine is. So the post-concussion headache is very, very similar to migraine, and actually we ended up treating at times as a migraine. Now, patients with migraine might notice a transformation of their migraine after the concussion. So intermittent migraine, a migraine that is episodic, might turn into chronic after a head trauma.
Thank you, Samantha. That was a great question. So if you're just joining us, thank you. We're here with Dr. Maike Blaya from the Memorial Neuroscience Institute. She's our headache specialist, and she's talking about headaches and migraines, something we're all familiar with. So engage with us by posting your questions on the Facebook page in the comments section, and we'll try to get to all of them during the live broadcast right now. If you would like to make an appointment in the Memorial Neuroscience Institute with Dr. Blaya or any one of our neurologists, please call 954-265-9500. And if you'd like more information about some of the services at the Memorial Neuroscience Institute, visit memorialneuroscience.com. So let's continue a little bit about this subject matter about lifestyles. This is something I've heard in the past. Is it true that women are more likely to suffer from headaches than men, or is it that men are less likely to seek treatment for a headache?
Definitely, migraines are more common in women, and I have kind of like a little. I have some numbers here: 4 to every 10 women and 2 to every 10 men will contract migraine in a lifetime. So definitely more. We don't know very clearly why. It's likely because of the hormones fluctuations that we see in the woman's life. You know, we have fluctuation. We see a peak of migraine incidence during the beginning of the menstrual period when the girls start their menstruation, and then there is another peak in early pregnancy or in the postpartum, and there's another peak during the perimenopause time. So that certainly hormones, make influence into the migraine patients. It's much less often in men.
That's interesting because I recently read somewhere that in children, headaches are more common in boys versus girls.
Yeah, so before the menarche or the menarche, like the first menstrual period, migraines are actually more common in boys. And then as both grow, it is more common. So a lot of boys grow out their migraines, and that's very interesting. Men, I have, much less, like I have maybe 15 patients, women patients with migraine, than one man with migraine in my practice. But there are other headache types that are more common in men. Cluster headaches are more common in men, and they usually come to the office like miserable and in terrible pain because it's a very debilitating headache.
So is it that they wait a little too long before they seek treatment, or is it, what is the circumstance, do you think?
With the cluster, the headache comes within attacks, but the attacks might last like a few weeks or sometimes even a few months. So usually I kind of joke with my patients, they disappear if they are doing well. If they are doing very well, I don't see them. If the cluster is back, they are back to my office sometimes every day. Yeah.
Very nice, very nice. So it looks like we have another question.
Kathy is asking, does a carcinoid tumor cause migraines?
So those would be within the secondary headaches. Some carcinoid tumors, I believe, they can increase the blood pressure, and they are related to serotonin. And serotonin is one of the big neurotransmitters that are related to migraines. So probably can increase migraines and can increase headaches too.
Very good. Okay, so here's another question about lifestyle. Okay. I read somewhere where the American Academy of Neurology suggests that seniors who suffer from headaches and currently smoke can be prone to strokes. What are your thoughts on that?
Yeah, there is it's a hot topic now talking about if migraine patients have an increased risk of stroke. And it's clear, it was shown that there is an increased risk of stroke in patients that have aura. So patients with migraine with aura have an increased risk of stroke. So it got to the point that there is a recommendation that absolutely no patient with migraine with aura should smoke, especially like as you get old, you increase risk factors. And also a woman with migraine with aura should not use birth control, because that increased the risk even more for stroke. We could not find a same correlation with stroke and migraine in patients without aura.
Interesting. So thank you. If you're just joining us, thank you for joining us. This is Dr. Maike Blaya, our headache specialist at the Memorial Neuroscience Institute, and she's answering questions that viewers are posting on our Facebook page regarding headaches and migraines. So please engage with us. Let us know what you're thinking about. Let us know what your questions are regarding these topics. If you would like to make an appointment with Dr. Blaya or any one of her the neurologists at the Memorial Neuroscience Institute, please call 954-265-9500. If you'd like more information, we have a lot of information on our website. Just log on to memorialneuroscience.com. So we have one more question. And that question right now, it's studies suggest that women approaching menopause suffer from more headaches and migraines than women who still maintain a regular cycle. You touched upon this a little bit earlier. But what treatment options and lifestyle changes do you recommend to those undergoing menopause?
Yeah, there's unfortunately no magic for some of the symptoms that women have to experience during their menopause, and some patients experience more migraines. Also, I have a lot of patients that have menstrual migraines. They usually only have headaches during their menstrual period, and as they become more irregular within the menopause, they are experiencing more headaches too. So sometimes they have to be on a prevention, on a daily medication, because they are having more headaches than just the 4 or 5 headaches a month.
Okay. Well, we have another question posted.
Nisi from Facebook is asking, could bad eating habits or your diet cause reoccurring headaches?
Absolutely. Migraine, the disease likes kind of like a very healthy lifestyle, don't getting out of the routine. You know, the migraine patients, sometimes they notice if they don't sleep well or if they are eating a lot of junk food, they get more migraines. Yes, absolutely. Regarding secondary headaches, probably also having, hyperglycemia, like high sugar, or being overweight or not eating well. You also might have secondary headaches too that not necessarily are migraines. But yes, that all helps.
All right. Well, I'm taking notes here because that's something I did not know. So it looks like that's all we have time for today. Thank you for everybody who posted on our page. We hope we have answered all of the questions out there. If you'd like to make an appointment, again, with Dr. Blaya or any one of our neurologists in the Memorial Neuroscience Institute, please call 954-265-9500. You can also log on to our website, memorialneuroscience.com, for a lot of our information that is online. Also, if you want to see more videos like this, please make sure you subscribe to our Facebook Live videos so that you don't miss our next one. Thank you all for joining us, and see you next time. And thank you, Dr. Blaya, for your time.
Thank you for having me. Thank you so much.